Did you know, based on the latest data from 2025, the social care sector in England is facing a staff shortage of approximately 152,000 roles, with a vacancy rate of 9.9%. This figure highlights the ongoing challenges in recruitment and retention, particularly in domiciliary care settings, where 74% of providers report recruitment difficulties. Trendsetters. Welcome back to Trendsy, the place where we decode the big trends shaping your life and equip you with the knowledge to navigate them successfully. Now, today we're diving into a topic that might not be on your daily radar, but trust me, it's a silent giant with the potential to dramatically impact all of us living here in the UK from this year, the social care workforce crisis. You might be thinking, social care, that's for other people, right? Maybe you picture elderly relatives in care homes or individuals with disabilities needing support. And while that's certainly a crucial part of it, the ripples of this crisis extend far beyond those immediately receiving care. It touches families, the NHS, the economy, and even the very fabric of our communities. Over the next 10 minutes, we're going to break down exactly what this crisis is, why it's happening, and most importantly, how it's likely to affect you from now going forward if no drastic measures are put into place. We'll explore the hidden connections and reveal why this isn't just a niche issue. It's a national challenge that demands our attention. So buckle up, open your mind, and let's get trendy about understanding the future of care in the UK. Let's start with the basics. What exactly is the social care workforce? Simply put, it's the dedicated army of individuals who provide essential support to adults and children with a wide range of needs. This includes care home staff, providing round-the-clock care and support in residential settings, home care workers, assisting people in their own homes with daily tasks, personal care and companionship, personal assistants, directly employed by individuals to meet their specific needs, support workers, helping people with learning disabilities, mental health conditions, and other complex needs to live fulfilling lives in the community. Now, here's the stark reality. This vital workforce is facing a critical shortage. Vacancy rates are alarmingly high, and the number of people needing care is only increasing due to our aging population and the growing recognition of diverse care needs. You might be thinking, so what? Someone else will deal with it, but let's delve deeper into how this shortage will directly impact you, even if you don't currently rely on social care services. Increased pressure on the NHS. Think about it. When people can't access timely and adequate social care, where do they often end up? Of course, in the hospitals, which will result in delayed discharges, increased A&E admissions for preventable conditions, and an already strained NHS become even more overwhelmed. This means longer waiting times for everyone, including you and your family, for routine appointments, surgeries, and emergency care. Imagine your elderly parent needs support at home after a hospital stay. If there aren't enough home care workers available, they might have to stay in the hospital longer, blocking beds for other patients, or worse, they might be discharged without the necessary support, leading to readmission and further strain on the system. The burden on families and unpaid carers. The social care system isn't just about paid professionals. Millions of people across the UK are unpaid carers, family members and friends who dedicate significant time and energy to looking after loved ones. When professional support is scarce, this burden intensifies. This can lead to immense emotional, physical and financial strain on these unpaid carers. It can impact their careers, their mental health and their own well-being. And who steps in to support them when they reach breaking point? Often, it's the already stretched public services or other family members. This creates a vicious cycle. Economic impact and your wallet. A struggling social care sector has significant economic consequences that will eventually hit your wallet. Firstly, a lack of adequate care can prevent people from participating in the workforce. If someone is caring for a loved one full-time without support, they may have to reduce their working hours or leave their job entirely, impacting household income and productivity. Secondly, a failing social care system can lead to increased costs for the NHS, which is funded by taxpayers. That's you. More hospital admissions, longer stays, and managing the consequences of inadequate community care all add up. Community cohesion and social well-being. A strong social care system is a cornerstone of a caring and inclusive society. When vulnerable individuals aren't properly supported, it can lead to social isolation, increased inequalities, and a breakdown of community cohesion. Think about the impact on individuals with disabilities who can't access the support they need to live independently and contribute to their communities. Or the impact on older adults who face loneliness and isolation without adequate social interaction. This affects the overall well-being and vibrancy of our society, impacting everyone. The potential impact on your future. While you might not need social care right now, the reality is that as we age, the likelihood of needing some form of support increases significantly. A failing system now means a potentially inadequate and underfunded system when you or your loved ones need it in the future. Are you confident that the care you or your parents might need in the coming years will be available and of high quality if the current crisis isn't addressed? This isn't just about them. It's about our collective future and the kind of society we want to live in. So, what are the key factors fueling this social care workforce crisis? It's a complex issue with several interconnected causes. Inadequate funding. For years, the social care sector has faced significant underfunding, leading to low wages, poor working conditions, and a lack of investment in training and development. Low pay and poor working conditions. Social care work is demanding, both physically and emotionally. However, the pay often doesn't reflect this, and many workers face long hours, high workloads, and limited career progression opportunities. This makes it difficult to attract and retain staff. Changes to immigration rules. The social care sector has historically relied on a significant number of international workers. Changes to immigration rules have made it more difficult to recruit and retain staff from overseas. Lack of recognition and professional status. Despite the crucial role they play, social care workers often lack the same level of recognition and professional status as those in healthcare. This can contribute to a feeling of being undervalued and less likely to pursue a long-term career in the sector. Demographic shifts. As mentioned earlier, the UK's ageing population means a growing number of people require social care services, further exacerbating the workforce shortage. Now, the crucial question: what can be done to address this crisis and mitigate its impact on all of us? There are no easy answers, but several potential solutions are being discussed. Increased and sustainable funding. A long-term funding solution for social care is essential, ensuring fair wages, improved working conditions, and investment in training and innovation. Improving pay and working conditions. Raising wages, offering better benefits, providing opportunities for career development, and reducing workload pressures are crucial for attracting and retaining skilled workers. In attracting and retaining domestic and international workers. Implementing effective recruitment strategies, streamlining immigration processes for care workers, and promoting social care as a valued career path are vital. Enhancing professional development and recognition. Investing in training, qualifications, and professional registration for social care workers can raise their status and improve the quality of care. Technological innovation. Exploring how technology can support care delivery, improve efficiency, and reduce the burden on human staff could offer some relief. The solutions require a collective effort from the government, local authorities, care providers, and society as a whole. It's about recognizing the fundamental importance of social care and investing in its future. You might still be wondering, how does this directly involve me? Well, here are a few ways you can engage with this issue. Stay informed. Continue to educate yourself about the social care crisis and its potential impact. Share this video and other reliable information with your friends and family. Advocate for change. Contact your local MP and express your concerns about the social care system. Support organizations working to improve social care provision. Consider a career in social care. If you're looking for a rewarding and meaningful career, explore opportunities in the social care sector. Your skills and compassion are desperately needed. Support unpaid carers. If you know someone who is an unpaid carer, offer them practical support, a listening ear, or simply acknowledge their invaluable contribution. The social care workforce crisis isn't some distant problem. It's a ticking clock that will impact all of us in the UK. By understanding the issues, engaging in the conversation, and demanding action, we can collectively work towards a more sustainable and compassionate future for care. Now, I want to hear from you. What are your thoughts on the social care crisis? Have you or your family been affected by it? What solutions do you think are most important? Share your experiences and ideas in the comments below. Let's have a productive discussion and work together to raise awareness. Thank you for tuning in to Trendsy. Remember to like this video, subscribe for more insightful content, and hit that notification bell so you don't miss our next deep dive into the trends shaping your successful living. Until next time, stay informed, stay engaged, and stay trendsy.